Optical coherence tomography is a relatively new optical imaging modality that allows high resolution cross-sectional imaging of tissue microstructure. OCT can imaging axial resolution up to 1 to 15 micrometer and imaging depth of this is 2 to 3 mm in the non-transparent tissue. Features of OCT. OCT imaging can be performed in situ and non-destructively, enabling the imaging of tissue for which biopsy should be avoided or impossible. OCT gives imaging of high resolution between 10 to 100 times that of the conventional MRI or ultrasound. Imaging can be performed in real time without need to process a specimen or conventional biopsy without need for transducing the medium as in ultrasound imaging. OCT is fiber optically based, can be attached with catheter, endoscope, laparoscope or surgical probes. OCT system can be engineered to be compact, portable and low cost depending on the desired system specification. Optical coherence tomography perform high resolution tomography imaging by measuring light back scattered or back reflected from the internal tissue structure. OCT imaging is analogous to ultrasound beam mode imaging, but it is based on detection of infrared light, while ultrasound using the sound. In ultrasound, a high frequency acoustic pulse travels into the tissue and it is reflected or backscattered from the internal structure having different acoustic properties, and these acoustic properties are electronically detected. While in OCT, the light is used as measurement of the back reflected or back scattered from the tissue structure, and this tissue structure is detailed in the OCT system. Unlike in ultrasound, though the speed of light is very high, rendering electronic measurement of echo delay time of the reflected light impossible. OCT system circumvent this limitation by using low coherence interferometry, also known as white light interferometry, to characterize optical echoes from the internal structure. The most common OCT echo detection scheme is based on Michelson interferometer. In this Michelson interferometer, this light is divided into two parts: sample beams and the reference beam. This sample beam is used to detect the internal structure of tissue by reflecting back to the detector. To assess the potential value of OCT imaging technology in improving visualization and pathology, as well as the diagnosis and treatment of given organ system, it is essential to first imaging normal tissue from the particular organ, then reference to this OCT imaging to parallel histology. This OCT is useful in oral cavity lesions, tongue lesions, laryngeal lesion like buccal polyp, buccal nodule, carcinoma in situ. All these lesions can be detected without histology by OCT. In head and neck surgery, two new generation OCT, optical frequency domain imaging and micro-optical coherence tomography, are useful to detect the parathyroid tissue just like histology. So in future, these OCT will very useful to detect tissue intraoperatively, and also they detect endoscopic biopsy tissue just like frozen section or histology without need for doing it. In summary, OCT and OCT adjunct have enormous potential for improving the diagnosis, monitoring, and both surgical and non-surgical management of disease ENT tissues. Conventional OCT provide objective information concerning the structure of tissue element with distinct optical backscattering and back reflecting properties. With regard to the larynx, conventional OCT studies of healthy laryngeal tissue ex vivo have demonstrated that OCT can detect spatial changes in thickness and transparency of the epithelium, the content of the connective tissue in terms of glands, vessels, as well as transition of connective tissue type and architecture of basement membrane. While polarization-sensitive OCT holds promise for detailed layer structure of true vocal folds, and there are new technology like spectroscopic OCT or phase dispersion OCT are currently in development.